My name is Dr. Ellen Hodges, and I help take care of pregnant women here in our region. So today we're going to talk a little bit about what gestational diabetes is, what causes it, and how to manage it successfully so that you can have a healthy pregnancy and a healthy baby. Gestational diabetes is a type of diabetes that some women get during their pregnancy when they have too much glucose in their blood. The placenta produces hormones that prevents the body from using insulin appropriately. And sugar levels get higher, and in some women, they can't produce enough insulin to overcome this. This can cause the baby to grow too large, which may cause problems with delivery. In addition, once the baby is born, the baby can have breathing problems and problems regulating their own glucose levels. Sometimes this requires the baby to be sent to a special care nursery, or if the baby's born in Bethel, to be medevaced to Anchorage. This can also cause a problem with the baby's yellowing of the skin, or jaundice, and abnormal increase in red blood cells. Gestational diabetes is not caused by anything that you did or didn't do in your pregnancy or before you were pregnant. It's just a reaction to the hormones from the placenta and is very serious, but it is very treatable. So it's important that if you're diagnosed with gestational diabetes, that you take care of yourself and keep in very close contact with the care team to treat your diabetes. So we treat it in 3 different ways. We treat it with meal planning, with physical activity or exercise, and with medications if needed. The main things to be concerned about in your meals and what you eat is protein. Protein are things found in meat, dairy products, fish, eggs, and beans, as well as poultry. Each meal should include a small amount of protein. Carbohydrates are the thing that we're asking you to limit or avoid. Junk food, including potato chips, candy, donuts, etc., should be avoided at all times. And also regular soda should always be avoided. Physical activity also changes your blood glucose levels and helps your body control them. It is very important that you consult with your healthcare provider before you engage in physical activity while you're pregnant to make sure it's safe for you and your baby, but most women can engage in moderate physical activity while they're pregnant. Some women who can't control their diabetes with diet and exercise are going to need to take medication to control their diabetes. In some cases, this will be an oral medication that you take, but in many cases, it will be an insulin injection. If that happens, you'll work with the diabetes care team to dose your insulin and to take it appropriately. One of the most important things about managing your diabetes is checking your blood glucose levels using a blood glucose monitor. This involves pricking your skin and getting a drop of blood and recording your blood sugar at that moment and writing it down in a log. Most of the time, we're going to want this to be done 4 times a day. In the morning, before you've eaten or drank anything, and 2 hours after every meal. It is very important that these blood glucose logs are kept regularly and turned in regularly so that we can monitor the health of your baby and your health in order to determine whether we need to increase the treatment for your diabetes or whether we can continue going with how we are. If your diabetes is able to be controlled, the baby can be born in Bethel and undergo routine monitoring after birth. Doing everything you can to help control your blood glucose levels will make sure that you will have a healthy outcome for both you and your baby.
have you come to the clinic today?
I've come for a routine prenatal visit, and I am also gestational diabetic.
Per CHAMP, gestational diabetes occurs when a pregnant woman cannot use her body's insulin well enough to keep her blood sugar in a safe range for her or her baby. The information below also applies to a woman who had diabetes before she got pregnant. If blood sugar is not controlled, there is a greater chance of complications during pregnancy. Often the woman has no symptoms. Gestational diabetes usually goes away after delivery. However, there is a chance the woman may develop diabetes when she is not pregnant or as she gets older. Some problems from uncontrolled blood sugar during pregnancy are greater risk of high blood pressure, seizures, or kidney infection. Baby may get too big, making delivery difficult. Baby is at risk for problems after birth. Baby has higher risk of developing diabetes later on. It is very important you try to keep your blood sugar levels in a normal range. To help do that, walk for at least 30 minutes every day, get plenty of rest, eat a well-balanced diet. If you don't know what to eat, you could call the Diabetes Care Team at extension 6133. You will need extra testing during this pregnancy, and you may have to go to the hospital early in Bethel, and if it's uncontrolled in Bethel, they will transfer you to Anchorage. The doctor may want you to do a home blood sugar monitoring 4 times a day and bring results to the health aide every week. And you have to call the clinic right away if your baby's moving less or if you have any other concerns.
What kind of exercise can I do?
You have to walk at least 30 minutes every day, or any household chores 30 minutes every day.
And am I able to lift?
You can't be lifting no more than 25 pounds.
What sort of a diet can I eat?
For any nutrition or any other questions, you have to call your diabetes care team. Did you bring your log with you?
I did.
Can I see?
Here.
I'm going to be faxing your paper to the diabetes care team and to your chart, so the provider and the diabetes care team will be looking at it, and you'd be expecting a call from either of them.
Hi Sharon, I'm Dr. Hodges. It's very nice to meet you. What brings you in today?
For a prenatal visit, and I am also gestational diabetic.
Oh, nice. Did you bring your sugar log for me to
did.
look at? Great. Ah, excellent. Okay. So, we want our fasting sugars to be less than 95, and I noticed that you have a couple that are above, but that's okay. We can have a couple levels that are above. And then I noticed that some of your 2 hours are above 120, so we like those numbers to be less than 120. Looks like here you ate some pancakes, some syrup for dinner, and your blood sugar was 142. So that might have been the cause of that elevated blood sugar.
Too high?
Yep, that's too high. For these 2 hour ones, we like it to be less than 120. Most of your values are okay. Do you remember at all what you ate on this day? It's okay if you don't.
I probably had soda.
Ah, yes. Soda with sugar in it is hard for your blood sugars. It makes the blood sugars go pretty high. All right. Do you have any questions about your blood sugar log?
So for the ones that are high, is it from the certain foods I ate?
It can be from the foods that you ate. It can also be how much you ate or when you ate them. There's lots of things that can affect your blood sugars. And sometimes as you get more pregnant or closer to your due date, the blood sugars can get higher.
And are there certain foods I can and cannot eat?
That's a really good question. We have a dietitian who works with our diabetes care team, and that person can help you plan your meals and talk about what you're eating. But generally speaking, we like you to avoid the sugary foods, and for sure any junk foods like the soda. That's really hard on your blood sugar. And but talking it over with the nutritionist, the dietitian, that will help you a lot. And she can go over things that you should and shouldn't eat and help you out. And when you get a high number like this, you can call them the next day and ask them to go over that with you if you have any questions.
Do you know what causes gestational diabetes?
Well, we think gestational diabetes is caused by your placenta. So sometimes when your placenta is active, it doesn't let your body use insulin like it should. So when you eat food, it gets broken down into glucose. And insulin's like a key that unlocks your cells so that the glucose can get in. So for whatever reason, in some women, the placenta makes it hard for your body to do that. So you require eating carefully so that you don't need too much insulin, and then some women need to take insulin to help their body. I can tell from your glucose logs that you don't need insulin yet. So far we're doing well with just diet and exercise. Have you been exercising at all?
Just some walking.
Okay.
Are there certain exercises I can do?
Well, we generally recommend that you walk about 30 minutes a day or do some housework about 30 minutes a day. We want to avoid heavy lifting, anything over 25 pounds, but lifting light weights can help also with your blood sugar. And this helps lower your blood sugar amounts so your body doesn't need to make as much insulin.
And then I tend to forget checking my sugars 4 times a day. Why is that important to check?
Well, it's very important to check your blood sugars because then we know how good your diabetes is in control. And that prevents things from happening to your baby after born or from the baby getting too big. If the baby gets too big, you might have a hard time having the baby. And then after the baby's born, they're more likely to have problems breathing or problems with their own blood sugar. So if we know that your blood glucose is under good control, we know that everything's safe for you and the baby. And if we know that if the blood sugars are starting to get high, even though you're eating a good diet, then we know if you need insulin or not. So it just helps us monitor your health and the baby's health. Any other questions?
When will I be coming in to Bethel?
For monitoring, we usually like you to come in earlier than you would normally if you didn't have diabetes. And we do extra testing for you and the baby. So we would maybe check the baby's growth to make sure that the baby's not getting too big. We might also do some testing of the baby's heart rate and the fluid that's around the baby. So you'll have to come in a little bit earlier. If you stay under good control and keep really close track of your diabetes, it should be no problem, and you can stay in Bethel and have a nice normal delivery here. If you have problems with your blood sugars, if you need insulin, or if we don't know how you're doing, if you keep forgetting to check your sugars, then we might have to send you to Anchorage, where they can monitor you more carefully. And then if your baby needs to be admitted to the special care nursery or anything like that, you'll be closer to that in Anchorage. Because some babies can have trouble after they're born. Most women have nice, healthy babies, especially if they keep good track of their sugars.